Why is your research important for clinicians nowadays treating chronic low back pain patients? Are patients-led goal settings not the standard already?
Yeah, so that's an interesting question. So I get that response a lot from people when I talk about patient-led goal setting. So we know that goal setting is in the guidelines, and we also know that people say they do goal setting. But the question is, how are they doing the goal setting? And so recently I've done a survey of nearly 300 physios, and they said that they involved patients in their goal setting, and they thought that was important. But when we had a look at it, they really only involved the patients at 50% or less. So they weren't really doing patient-led goal setting, where the patient is actually setting the goals themselves.
Okay. How would you concretely implement your results in daily practice?
Yeah, so I guess as a physio working in a pain clinic, I get to spend a lot of time educating patients about chronic pain. I spend a lot of time facilitating their goal setting. I've got the skills, I guess, that comes with working with chronic pain patients, so I'm able to spend that time doing that.
Okay. What would you do differently if you could restart your trial with no limits on resources?
So yes, that'd be my fantasy. So probably a multi-centre project with multiple physios or clinicians doing the treatment. So our project only used one clinician, which is standardised, but we don't know how relevant it's going to be with other clinicians. Different cultures as well, which is relevant in Australia. And also looking at tertiary care patients rather than primary care patients, and different countries. So I'd love to come back to Stockholm.
Okay, great. Thank you for this interview.